Hi, I'm Ahmet Akman, a glaucoma specialist from Ankara, Turkey. Now it's time for artifacts and anatomical variations in OCT scans. We have two kinds of false diagnosis in the OCT scans. The first one is the red disease, which is the false positive result. OCT looks like glaucoma in a healthy eye. It's surprisingly common, and following are the most common causes. Let's start with this patient. On the right eye especially, we see a lot of red areas on the pie graphs, and when we look to the thickness maps, we see black unscanned areas. 2 years later, we scan the same patient and the OCT looks much better. What's the difference here? The patient had cataract surgery in between, and the signal strength come from 4 to 7 in right eye, from 3 to 7 in the left eye. So you see, when you have bad quality OCTs with low signal strength, the RNFL looks thinner. So signal strength, signal quality is the first important point for red disease. Another one with areas of red RNFL in the inferior quadrant, when you look to the signal strength, it's 6, not very bad. But when you look closely and rescan the patient, now you see all those red areas are not there anymore. So what's the difference? When you look to the RNFL deviation map, you see the retinal vessels are not continuous, so it's one of the reasons for these red areas. The patients move the eye during the scan, and you have a motion artifact causing the RNFL lost red disease. So eye movements and poor centration is important also. Another patient, which is a very common one, are these superior RNFL defects real? You see there is an area of thisnet RNFL thickness in the red area between two humps. When you look to the macular scans, they are completely normal. The depression in between the two humps are artifacts caused by the RNFL entering optic nerve as two separate bundles. This is a very common artifact we see in a lot of patients, so we call them split RNFL. This is also an interesting one. There are symmetric inferior RNFL defects, but macula shows ganglion cell thickness is normal. When we look to the thisnet plots closely, we see the RNFL thickness is quite good, but the RNFL pattern does not fit to the expected normative database values. If we can move the thisnet plots to the left or to nasally, we will see the RNFL thickness will fit the green area completely. So this is also a common artifact in the myopic eyes. We call it temporal RNFL shift, and sometimes we see nasally shifted RNFL in the hypermetropic eyes. In some eyes, like the one in the left eye of this patient, we can have both these artifacts together as RNFL split and shift. Look to the superior quadrant, we have two bundles entering the optic nerve as split RNFL, and when we look to the thisnet plot for the inferior quadrant, we see the shifted RNFL for the left eye. Another one, you see a black area in the RNFL thickness map. It means the retina was not scanned there, and it's evident on circular tomograms, on thisnet plot. When you see an area of 0 RNFL thickness, it is not possible. It must be an artifact. Because of the fluor effect, RNFL can never go to 0 in any peripapillary OCT scan. If we ask the patient to move his eye a little bit and rescan the patient, now the black dot is out of the RNFL calculation circle. So this is a Weiss ring causing red disease artifact. You can ask patient to move his eye and rescan it a few minutes later. So when the Weiss ring is away from the calculation circle, this artifact will go away. Another patient with a lot of RNFL defects, you see macular defects here, you see visual field defects here. When you look to the optic nerve heads, as you have to look to the optic nerve all the time, you see these white spots which are optic nerve head drusen. So optic nerve head drusen can cause a lot of RNFL and visual field defects. The other kind of artifact we see in the OCT printouts are the green disease artifact, which is the false negative result. OCT looks normal in a glaucomatous eye, but it's less common. Following are the most common causes. This is a glaucoma patient, but RNFL thickness looks good. The left eye has optic nerve head cupping. When you look at the visual fields, there are defects. When you look at the macula, there are ganglion cell defects. So except the optic nerve head, all the remaining tests show glaucomatous damage in the left eye. What is the reason? The reason is when you look to the RNFL circular tomogram, you see vitreous is pulling the RNFL in this area. So vitreoretinal tractions around optic nerve head is the most common cause for the green disease. Another one, on the right eye, you see glaucomatous damage, but on the left eye, the RNFL looks normal. The reason for that is the early posterior vitreous detachment, which caused the Weiss ring just coming off the optic nerve head, but not moving a lot. So rescanning this patient is not helpful. You see the funny-looking optic nerve on the RNFL deviation map. This is the Weiss ring causing the green disease. This one is quite easy. Look to the left optic nerve. It has a very thick RNFL, which is caused by the myelinated nerve fiber layers, which can be a reason for the green disease also. So before commenting on an OCT scan, look for scan quality problems and artifacts. Look for possible anatomical variations. RNFL, macular ganglion cell, and optic nerve head scans must be evaluated together, and be careful for the glaucoma masqueraders. Thank you.